still watching Bupilong with me, Pulemo Lebati, and now I'm joined in studio by Dr. Duvern from the Oncology Center in Sutton, and he is here to unpack eye cancer. Doctor, welcome to the show.
Thank you, Glenn. Thanks for having me.
Thank you for coming through. Doctor, as you saw earlier, one of the person that we're focusing on today, Mr. Misani, had to lose both his eyesight due to eye cancer. Most people at home may not understand what separates eye cancer from other cancers out there. Please, if you can elaborate on that.
Okay, so basically the most common type of eye cancer in children is a tumor called a retinoblastoma. And as the name suggests, the retinoblastoma starts in the retina of the eye, which is in the back portion of the eye. And the retina is made up of little nerve cells. And what these nerve cells do is that when light comes into the eye, they transmit this light into the brain, and it's interpreted as images in the brain. So we understand what we're looking at. Now what happens in a retinoblastoma is that these normal nerve cells start to mutate and they grow. There's some sort of mutation that happens in them, and they start growing uncontrollably, and they form a tumor which starts to damage the normal cells in the retina. The cause of this mutation we don't really, in 90% of the cases it's sporadic, so we don't really know the cause in 90%. 10% is genetic, and genetic means that it's passed down from parents to their children. If it's genetic and the mutation is passed from parents to their children, generally it occurs at a much younger age, so below the age of 1 year old, and it usually involves both the eyes. If it's the sporadic type, which means that damage occurs in the DNA of the cell and the cell becomes mutated for some reason we don't know, it's generally in older children, and it usually involves one eye.
My goodness. Okay, doctor. So, I mean, if you look at also, I'll go back to Dumisani. He was only 2 years old when he lost his sight.
Yes.
Could he have somehow saved his vision?
If it was picked up at an earlier stage, then there's other treatment options where sight preservation is still possible. So the important take-home message here is that if a parent feels anything wrong with their child's eye, they should go to their doctor as soon as possible.
Yeah. So doctor, you just mentioned if the parent can detect if there's something that's not right with the child, what
Yes.
are the symptoms to look out for?
Well, importantly, anything, if a parent feels that anything is wrong, rather see a doctor. But some important things to look out for would be, one of them, if there's a white reflex in the eye. And basically, we all know that sometimes when you take a photograph or a bright light is shown in your eye, there's a red reflex that comes back, or you see a red sort of color in the eye. What happens in children with a tumor in the eye is that there's a white reflex that comes back. And that's one of the most important signs, and that's usually the one that's how this is usually picked up. The second important thing is a sign called strabismus, and that's when you notice the child's eyes are both not looking in the same direction. If they're looking in different directions, it's also an important sign to take the child through to the doctor and get them checked as well. There's also swelling of the eye that can be important, or even a red color on the surface of the eye. It's called rubeoiridiosis, and that's important to take the child through to see their doctor as well. Generally, it's not usually painful, but sometimes it can be painful, and generally that's more if the tumor is advanced. So you want to pick it up before that.
Okay. Dumisani's mother also passed away last year due to cancer. So when you're in a family like that, and you have family members as well, the father and of course Dumisani's siblings, everyone is mostly worried, what if I have it? So would you say that it's advisable for the family perhaps to go test just to make sure that they're in the clear?
Definitely. You should go to a genetic counselor, and what they'll do is they'll draw up a family tree and look at who's had cancers, and they'll look at what cancers they've had, and then they'll give them a list of the type of genetic testing they should do. And then, it's important with retinoblastoma, if you do have the gene, it doesn't mean that you necessarily will get an eye cancer, but it's important to go more often for eye tests, and it'll also direct you to be screened more carefully for cancers if you do have the genes.
So for someone like Dumisani or Dulanko, pardon me, I always just get caught up in speaking names as well. So for Dumisani who stays in Fort Loras, how then, because there's only limited resources, and if you see perhaps of the accessibility to the hospital and the clinic, they don't have much access. How do they get the proper care, especially for him, because he still goes for his checkups regularly?
I think if he goes through to his local doctor, they will refer him through to the appropriate people. You know, there are obviously tertiary hospitals that, you know, from the local clinics, that they will refer him through to the tertiary hospitals, and they have specialists in these areas that will definitely be able to advise him on the proper genetic testing and what testing he should do. And generally, what people with these genes would need is an ophthalmologist or an eye specialist to look in their eyes quite often.
Okay. And doctor, at home, just to make sure that everyone is in a safe environment, their living conditions are appropriate. For example, if you have maybe someone who's also suffering from any type of cancer, what would you advise that they do at home differently from just living a normal life? What should the home look like?
Well, you know, a diagnosis of cancer, especially in children, can be quite stressful on the entire family. You know, you can feel feelings of anxiety, stress, guilt, you know, even anger. It's important, I think, for people in the family to get as much information as they can about the cancer, and so that they're comfortable with the treatment decisions that are being made. They are comfortable with what's happening to the person with cancer, and also for the person with cancer, if they're old enough to understand, you know, to get all that information as well. You know, long periods of time are also spent in hospital with doctors, and if you have a young child who's being pulled out of his home and being put into a hospital with doctors in an unfamiliar environment, they can often get feelings of abandonment. So it's important there to for the parents to reassure them constantly. But the doctors that are involved with these children also are quite good at sort of reassuring them with that. In terms of the home, you know, it's important to get a lot of community support as well.
Okay.
You know, so tell the community what's going on, because if the parents need to be with the child in hospital for long periods of time, you don't want to you know, sort of not take care of the other children. So you will need help at home, you know, regarding that as well.
So doctor, I think even Dumisani at home, he's also just wondering, will it ever come back? You know, because he says he was only 2 years old, and the mother was the one who was doing the taking care of him and making sure that, you know, he went for his surgery and all of that. Is he completely in the clear? Because they removed the eyes, so they took off the body parts where the cancer was mostly spread. Is he completely on the clear?
Look, with cancers, you know, you've always got to go regularly for your checkups. To make sure that it hasn't come back. Obviously, with, you know, if the cancer hasn't come back for a long period of time, the chances get much less over time. But also, if you have a genetic mutation that predisposes you to get retinoblastoma, you are also predisposed to getting other cancers as well later on in life, things like soft tissue sarcomas. So you should be you know, more vigilant and go to the doctors more often. If you think that there's anything that may be wrong, go to see your doctor as soon as possible.
Okay. Well, doctor, thank you so much for coming through.
It's a
And
pleasure.
remember, you can find us on Twitter if you wanna carry on with the discussion at Bopilon Show, and we can carry on with the discussion on eye cancer or any other thing that you would like to comment on today's show. As for me, thank you so much for joining us. We'll do this again next week Saturday on Channel 4 for SABC News.